See if you guys are on there. Thanks for coming to this live webinar. I'm here in Huntington Beach, and I just wanted to share with you guys some awesome tips and tricks and things that we do in the clinic to help you guys get out of headache and neck pain. And I got a couple screens going here, so I'm trying to figure out. I'm looking at the camera, looking at this stuff. We're going to go over to some slides in a second, but feel free to chat in there if you want. I think I'll be able to see that, and just wanted to get going and help you guys with some stuff here. So what I'm going to do for a second, first thing is I just wanted to share what we're doing on here. And so my goal really is to give you guys some things that you can start doing on your own, that you can start just doing like today. If you have a headache or neck pain or something else going on there, that you can begin to just work with it and do some things on your own to get rid of it. So I'm going to show that to you, some things I teach in the clinic, some things I teach patients with that, and just things that I've noticed throughout the years of treating patients. There's things that we always address with these things. So I'm going to share this with you today, and just giving you like tools and habits and things that you can do. At the end of the webinar, I'm going to also share with you just some other ways that we can help you if you want some more help. Some really cool things that we're able to do now without having you to have come into the clinic, but we can still help you get over that if getting to the clinic is an issue for you. So what I'm going to do is I'm going to bring over my screen here and then share my screen, and let's see how this works. It's going to look weird for a second. Gonna back off, come up to here. All right, so let's see if you guys get that. All right, so here it is. How to DIY headache and neck pain. And this is what we're going after today. And again, I already just want to introduce myself a little bit. I am a doctor of physical therapy, and I got my degree undergrad at Vanguard University, and then I went and got my doctorate in physical therapy over at Chapman. So that is what is me right there. I'm a father of 4 boys. I coach soccer. I'm also an executive pastor at our church in Huntington Beach. So it's a bit about me. Enough about me. So here we go. What we do at Change Sports Physical Therapy is help people get out of pain and get back to doing what they love. And that's really the whole thing that we do in the nutshell. That's what we do at the clinic, and that's what we're doing today. So getting rid of headaches and neck pain. Before we kind of get into the details about that completely, I just wanted to give you guys a little bit of an idea of what the roadmap is getting out of any kind of pain or rehabbing from anything. And these are the steps that we follow in the clinic with every patient, every condition. And so it goes from evaluation, then you go into this calming phase, a mobility phase, a strengthening phase, and a return to play phase. There's this on our website, there's a guide, 5 steps to get out of pain, that go into detail about this. And so what we're doing today, obviously we're not doing an evaluation on you. You're not a patient. So there's no patient-provider relationship here. We're just sharing information. So we're skipping that step, but it's very important. So if there's anything that you have specific going on, you'd want to get that checked out. This may not be for you. And specifically, again, we're not treating you. We're not diagnosed to you. So you should go see a physician if you have any issues that you want addressed specific to your thing. This is for educational purposes, and so that's a little disclaimer there. We got that out of the way. You understand I'm not treating you through a webinar. All right, so we're skipping the first part and we're going into the calming phase. And really what that means is getting you out of this inflammatory stage of healing and into out of that stage and then into the mobility stage. And so a lot of what we're doing today is going to be talking about that and how you can do that on your own. And that is where you're at. So that from here, then you'd go to mobility, strengthening, and return to play. So first of all, I also want to kind of explain a little bit when we're talking about headaches and neck pain. What I'm dealing with here on this webinar is specifically what we would call cervicalgenic headaches or neck pain. And all that means is neck pain and headaches that come from the, of course, I am getting an update on my computer. Stop updating. Hopefully you guys aren't, oh, you are seeing that. Oh my goodness, this is pretty funny. Now, of all times to do that, I'm gonna see if I can slide that out of the way. All right, now you know, live webinars, here we go. Okay, so doing the cervicalgenic headaches and neck pain. And there can be, so that just means like muscular, like a neck issue. And so there can be other reasons for that, which need different type of intervention. And, you know, there can be a lot of other reasons for the headache, but what I see in the clinic, a lot of patients are relieved from their headache and neck pain stuff from these approaches. And so, again, it's really, it's what we do in the clinic. What this is not for is if you have any signs of a disc herniation or nerve involvement, which means like numbness or tingling in the arms, shooting pain when you sneeze, arms or hands falling to sleep, all these mean like there's like a neural involvement in there, and you would definitely want to get that checked out before you start anything on your own. If you're like an extreme amount of pain, don't, you know, this isn't for you. And if you've recently been in an accident and you haven't been diagnosed, you definitely want to get that checked out, because there can be some other, you know, structural things going on there beyond the scope of a little DIY webinar here. So, so here we go. So approaching DIY headache and neck pain, and what we're going to go over today, we're going over 5 different approaches to how you can address these things on your own. And here they are. Here's the 5, and we're going to go into them in a little detail. But posture, ergonomics, self-soft tissue work, stretches, and modalities. And so we're just going to dig into that right now and see what we mean by that. All right, here we go. Addressing posture to get rid of pain. And when we talk about posture, most people end up thinking posture means you need to sit up straight. And when I'm talking about posture, I mean just the natural resting position that your body has when you are there. And so here's this little picture here of what we're talking about. So forward head posture means that the head going forward. And this is kind of be a kind of a typical posture that would be susceptible to neck pain and headaches. So forward head posture, tightness in the chest muscles, and then we call a hyperkyphotic thoracic spine, or just a excessive rounding. And so on the picture on the right, you see the faulty posture, and then on the left, you see normal posture. And what happens with these things is that I'll break this down. So the forward head posture, what it does is it places the muscles that call the suboccipitals, or the muscles in the back of the head and the neck, and we'll go over those in a little bit later. It places them in a shortened position, and then it sets by having that kyphosis, or that thoracic spine that's curved. It creates a tightness in the chest. You can get like bad sitting posture, and causes more strain on the neck muscles and the head to be in a position where those muscles are having to work a lot harder, and they're being compressed there. It's super common in our society, because when you're driving on the computer, on your cell phone, eating, watching TV, all these things cause you to be in this slump position. And so our body adapts to, is like, hey, you want to be in this position? We're going to adapt to it. And your chest muscles start getting tighter. You start rounding out on the spine, the head starts going forward. And so what needs to happen is we need to do some things to correct that in order to prevent this headache. So if you find yourself, you look in the mirror, or have someone take a picture of you just in normal resting position from the side, your ear, kind of the center of your ear should be over the middle of your shoulder, like it is on the left side. And if it's forward at all, then that is there's an issue right there. So that's the first thing that you can start. First thing is to notice if you have it, and then addressing that with what we're going to go over later on is really kind of addressing these posture things and how to address the posture so that you don't have these pain going on. So so that first one is looking at the posture. What's your posture like? Do you have those characteristics? And then we move on from there. The next one here is ergonomics, and ergonomics is just a fancy word for kind of what is your work environment. And the definition there is study people's efficiency in their working environment. And really what it means is what I'm using it in ergonomics here is looking at when you are in your work environment, what position are you putting yourselves in? How are you doing your work? And so this plays a huge role more with like in this sitting position here, and specifically at the computer. So if you find yourself at the computer a lot, like a lot of people in their jobs, they're spending a lot of time at the computer. If you just Google like desk ergonomics or best way to set up your computer station, there's tons of information out there on the correct way to do that. And so you can see what I mean, but I'm just going to give you a few tips here on what a correct setup for the computer should be. Number one is the screen should be straight in front of you. So if you find yourself facing one way and then your screen's to the left, or you have two different screens and you kind of turn your head left or right, that setup of not being facing straight on is going to cause issues over time. The next thing is the height of the screen. And this is, most people it's hard to get this right, but the top third of the screen of your computer should be at your eye level. So when you sit down, your eye level should be the top third of the screen. And if you're having to look down, like say like at a laptop all the time, if you're having to look down more, if you're doing that all day, it's going to be causing some neck issues. So just raising the screen level so it's up at the top third of the screen is at eye level, that'll do a huge improvement in that. The other part is just your seating position. And so not positioning your chair. We could go over a whole bunch of things on positioning your chair so that you're not in this slouch position and like not having to reach forward for the mouse. Again, think about that rounded shoulder, forward head posture that we're talking about. If you find yourself in that position when you're in your chair, you need to adapt your chair. One of the best ways to do that, you might not think of it, but your chair, if you have a tilt capacity on it, if you just very slightly tilt the seat forward, that kind of pushes you forward so you're not in this slouch position. And you don't want to be like leaning forward, but just slightly and angle it forward a tiny bit, and that positions you up a little bit better. And then the next is just another tip is the arms rest. So having your arms resting either on the chair rest or on the desk or something that's going to be able to give you some rest on there. So these are some quick things on here on your computer station. And then just on driving, what I would just say on there is, has the back of your head ever met the headrest in your car? Most people never find their headrest. So that some things you can do too, just when you're driving, obviously you're not going to have your head rest against the headrest the whole time, but every time you stop at a light, see if your head can reach the headrest. And if it can't, that's either your positioning is too far forward, or actually your posture is so tight that you can't reach it back there. So getting yourself so that you can get your head back onto the headrest. And then a lot of times that seat is slid back a little too far, which forces you to reach forward with your arms, causing that slouch posture there. Okay, that's just really quick, some ergonomics. There's a lot of other things you could go into with this, but looking at your computer station, you're driving. And if you find yourself in a different work environment, just think of the postural things we went over and how you can address those, improve those. All right, so those are some like everyday things that you can be looking at. And the next part that we're getting into is pretty cool. It is just some soft tissue work. And so what we mean by that is just some different things that you can do to self-massage or soft tissue release in areas that are tight. And this is something that maybe you don't think about or you didn't really know what to do. And so this suboccipital release is something we're going to talk about here. And your suboccipitals are just the muscles in the back of your neck. And I thought I was going to have a picture of it here, but I guess I don't. Sorry about that. If you reach that kind of behind your skull, let me see if I can bring you on screen here. Let me see. It's going to get kind of weird for a second. Bam. All right, there we are. So if you look at, so back here, right here, these are your suboccipitals right here. So base of the skull, the neck, just reaching back here. And this is what we're talking about. We're talking about your suboccipitals right back there, okay? I'm going to share my screen again. It's going to get all funky, but there we go. Okay. And so a way that you can kind of address this is on your own is taping 2 tennis balls together, or you put it in a sock and tie it just like that in the picture. And what you do is you just lay down on it. So face up, laying on the ground and laying down so you get a little bit of pressure on those suboccipitals. And you can either just lay on it and hold it there for like a minute or so with some like a pressure point, or you can roll back and forth on it. Another way to do that is with the foam roll. There's also like other products you can find online if you Google search or Amazon suboccipital massage stuff. There's things there that you can use on your own. But that's probably if you're having a headache or neck pain, that's probably the number one like bang for your buck thing that you can do is get down and try to release that. And the other one would be releasing your front chest muscles, the pec muscles. And you can get like a tennis ball, or we use a lacrosse ball in the clinic, and kind of getting in the doorway and pressing so that your chest is up against that ball and rolling on that. And that's another way to soft tissue work that area. But with the pec muscles, we're going to go a little bit into this next section, which is stretches. So we have your posture, your ergonomics, some soft tissue work, specifically your suboccipitals there. And then the next one would be just different stretches that you can do. So the best stretch in the world, if there is such a thing, but I think it is specifically for posture, is this foam roll pec stretch. And what it is just laying on a foam roll. If you don't know what a foam roll is, it's just a foam, and it's a tube or a roll that you lay on, like the picture there. If you just lay on that, just like that, with your arms out, palms up, and laying on there for 2 minutes a day, that would address so many of the things that we're talking about. Again, we're looking at those postural issues, so that it's addressing the forward head, the tight chest muscles, and that curvature of the thoracic spine. Laying on that, just stretching on that, getting yourself in a position so that you are stretching that. That's probably the most simple and the easiest thing that you can do right now that will start changing it. Again, this has to be it should be a habit that you establish yourself into. And I tell people all the time, the foam roll is like brushing your teeth. You brush your teeth every night, hopefully, to prevent cavities. You should be on the foam roll every night or day to prevent body pain, so back, neck issues. The next one is a levator scapula stretch, or you can kind of turn this into a suboccipital stretch. And what it is just kind of that picture displays it a little bit there, but you're just pulling your head, kind of looking down towards your opposite hip, and getting a little bit of a stretch on there. You can use the other hand to kind of tack it down to get a little bit better of a stretch. And if you kind of do a little bit of like a chin tuck, kind of pulling it in, you can get that suboccipital area to stretch it out a little bit. And this would be more of like a relief if if in the middle of having some pain, something you can do. Obviously, if you have more pain when you do this, don't do it. Any of these things, if you have more pain, sharp pain, numbness or tingling, anything like that, you just want to stop it. You wouldn't want to jump in on it and do that right then. And all right, so those are kind of 2 stretches that I would say if you go after these things on your own, you would be able to really start getting rid of that headache and neck pain. And all right, number 5 here of this, and if you guys joined in, if you missed the beginning part of this, I'm recording 2 today, so one at 11, one at 4. I'm gonna record the one at 4 o'clock, and I'll send that one out to everybody and that attended it, so you can get that information if you missed it. The next one, it would be modalities. And so what I mean by modalities is just different things that you can do to apply to it to get better. So some of the modalities that you could use on your own, ice pack or heat pack, we'll go over that in a second. And there's like these home electrical stimulation units or TENS units. And then in the clinic, we would use like an ultrasound or different things that you can use in the clinic. But on your own, it's funny because the biggest, probably one of the biggest questions I get, or the most things I get questioned about in the clinic is, should I put ice or heat on it? And I think it's hilarious because it's probably the most, like the oldest remedy ever, right? You put heat on it, or you put ice on it. And there's still like so much, like it depends who you talk to. They'll tell you one thing or tell you another. And it's like, it's so like, come on, how come we can't figure out what's better, ice or heat? I've actually wrote a blog post on this. It's on our website. If you go on our website, sportschange.com, and then you just type in ice versus heat, you'll find the blog post there. But really what it comes down to with ice versus heat is, what do you want it to do? What's your goal? And ice and heat, cold or heat, will they do the opposite. Obviously, they're opposites to each other. So heat helps increase blood flow into the area, and so that can be good for a muscular thing. It'll help relax the muscles, help to increase the blood flow in the area. But what it also does, it also increases inflammation. So heat kind of opens the spigot, if you think about it that way, and things flow more. So if you have a newer injury, or if you just have like something that's inflamed or irritated, then it's gonna cause more inflammation. And ice does the opposite. It kind of closes the spigot. It reduces inflammation, reduces blood flow. And so it depends what you want to do in your situation. Do you have an inflammatory issue in your neck right now that you want to stay away from? Then don't heat it. Or is it something that you do want more blood flow going into it to release it, and you do that? So it really depends what you want to do. What I would say as a rule of thumb is would be to start with ice. And if you're in this, if it's a new thing, or if you have pain at rest, just try with ice. A lot of times it's an inflammatory issue that's going on. So I would start with ice. If you're like, oh, I hate ice. Some people, like, they can't stand ice. You could do a contrast, so heat it and then ice it afterwards. And then if you're really down, if you really want to just do heat, you could do that. But just knowing that if you do have an inflammatory issue, it is going to cause more inflammation. So the next thing there is a TENS unit. So you can get these on Amazon and different places. You just place them on the muscles of the neck, and really all it's doing is helping to relieve it temporarily. It's not really it doesn't have much of a clinical use as far as like healing property, but it would just might help you reduce the tension and reduce the pain a little bit. And I think people get hung up on a lot of times on the modalities of it, like heat, ice, TENS, like, there's like laser and clinic, all this stuff. But I would say they only account for about 10% of the benefit that you'll get out of it, even in the clinic. And most of the benefit is going to come from changing your posture, changing your ergonomics, doing some stretches, some habits of stretches and soft tissue work. That's going to give you the most bang for your buck, and it's going to get you the changes that you want to see out of it. And so there we have it. There's approaching it from 5 different angles. DIY your headache and neck pain with posture, with your ergonomics, soft tissue work, your stretches, and your modalities. And these are things that you can do on your own. You can start today, and you can just put these into action today. So you can take some of those things that we just went over and start addressing it. What I wanted to do too is to, our goal here is just to be the most helpful that we can be with anyone, whether you're in the clinic or you're not in the clinic. That's why we're doing these webinars, putting this out here. If you want us want me to help out, we definitely can. And here is something that we are starting out to, is this one-on-one online consultation. And so what we can do is, through an app that we have now, we can set up a visit through the phone, through an app, and we'll just do a one-on-one consultation with you. We'll interview to see exactly what your situation's like. We can even look at like your range of motion through the camera, your posture, talk about your ergonomics, and give you suggestions on how to improve them specifically, and give you design you a home exercise program specifically for you. And what I'm going to do is I'm going to jump over on the screen here to show you this program that we have. Oh, I'm not logged in. You guys are going to see my login. There we go. I'm going to stop sharing for a second here. There we go. Log in. Okay. I'm here. I'm here. You can see me here. Okay. I'm going to screen share again. Going to get looking weird. Does the tunnel vision thing for a little bit. So what we have here is just a little bit an idea of this this program that we have. And what I wanted to do is come over to this clinic library just to give you an idea of what we can do. We'll get you on the app, and then we'll show you just some specific exercises that you can do, and then give you some videos that you can do on your own. So for example, here's a little thing on the foam roll.
Lie on a foam roll.
And I'm not sure if you can hear the video, but we can go through that, show you exactly some things you can start doing on your own, and just kind of talk you through it there. So that's just something real quick that we could do if you guys wanted to get in and do a one-on-one consultation. We'll go over like soft tissue work you can do on your own, modalities you can use on your own, and just also you have access to me just personally through the app. After we have our one-on-one, there's like a chat function on there. You can reach out if you're having questions about stuff. So I'm pretty excited about it. I think it's an awesome way to really get some help when you don't have to make a visit, don't have to come in, and you don't have to go through the insurance if you have high deductible. And here's what we're doing today. Here's my little sales pitch for the day. Is that this consultation is only $49, which is still like pretty cheap with if you think about the visits that you'd have to do if you were paying self-pay or going through insurance. But what we're doing today, we're just offering this at half off. So only $24 if you want to take advantage of this one-on-one consultation with you guys. And so there's, and if you want to do that, you would sign up. There's a link there to sign up. I'll also send you an email with the coupon code that you put in so that you can get that $24. The coupon code is going to expire, and it's just a limited time thing that we're doing for the webinar people here. So if you would like some help with that, you can definitely, this is the next step if you want some more help. Again, you can take this and do it on your own. I do hope that you're able to do that on your own, but if you find that you just want a little more coaching, a little more direction, someone to give you a little more input specifically on what's going on with you, we're here to help. And also, if you're local, you could come by the clinic and we can do a lot of hands-on stuff too. There's a blog post we put on neck pain on our website, and there's a video at the bottom of that just showing some things that we'll do in the clinic with patients. So if you want even kind of the next level of help would be actually coming in and being a patient. So there's just whatever you want to do, however you want to address your neck pain issues, you can do that. And I'm going to go all the way back to this first one. So whatever you need to do, whatever help you need, we're here to help you. So if you want to do this completely free, just go try these things. If you want, kind of the next little step would be just $24 one-on-one video consultation, and we'll do that. If you were like really need more help with it, then you could come into the clinic and we could just work with you. We have PPO insurance. We're in there with most of those, and we do cash pay and self-pay stuff. So yeah, I hope this was helpful to you. If you guys have any questions, feel free to you can chat in on the live stream here, or you can send me an email, and just matt@sportschange.com, and just feel free to reach out anytime, and you'll be getting a follow-up email from me just going over some of the stuff that we had here, and then I'll give you a link to the recorded webinar too, if you want to, for everyone that signed up for it. So thanks for coming in and taking time out of the day to listen to this. Hopefully it was helpful, and I will talk to you guys later. Hopefully you guys have a wonderful day, and I will see you later.